Dr. Beverly de Valois is a widely published research acupuncturist who has carried out several pioneering clinical studies into improving the quality of life for people diagnosed and treated for cancer. For the past 20 years, she has worked in the supportive oncology research team at Mount Vernon Cancer Centre, which is part of the North and East Hertfordshire NHS Trust. One of her studies looked into the use of acupuncture to improve the quality of life for people with lymphedema. The study was published in Evidence-Based Complementary and Alternative Medicine in 2016 and was funded by the National Institute of Health Research as part of its Research for Innovation, Speculation and Creativity funding stream.
It was very exciting to be awarded the NIHR grant to use acupuncture to manage well-being for people with lymphedema, and we were probably amongst the first people in the world to do this in a study.
Lymphedema is a swelling in the tissues caused by damage or disruption to the lymphatic system.
This is a chronic, lifelong condition. Once you've got it, it's very unlikely that it will go away, and it remains a threat for the person's entire life.
The aim of the study was not to treat the lymphedema itself, it was to improve the quality of life. But, as Macmillan lymphedema nurse specialist Elaine Melsom, who worked with Beverly on the trial, explains, the results were quite surprising.
We found that the patients perceived there had been improvement in the size of their limb, even if there wasn't a measurable reduction. And this led them to feel more positive about the condition. It increased their self-management and it reduced their anxiety about the condition.
Mother of five, Val Fear, was referred to the trial by Elaine. Val was diagnosed with breast cancer 2 days before Christmas in 1999. She had a lumpectomy in January 2000, followed by chemotherapy a month later. She developed lymphedema almost straight away, which had a very significant impact on her life.
Emotionally, I found it hard because my arm looked so different. It was very swollen. My fingers were like sausages. People were constantly asking me what was wrong with my hand. Buying clothes was a nightmare because one arm was at that point 40% bigger than the other. And I also was having a lot of nightmares. From the time I started the chemo, I was having some very bad nightmares. Wasn't sleeping, frightened to sleep, and I wasn't eating properly. So it was not a good time in my life. It wasn't good at all.
She had just so many adverse consequences as a result of her cancer experience, but also the lymphedema. Just her journey through that study was, and what I learned from her has been kind of a big inspiration in my life and a big inspiration for how people with cancer can respond to acupuncture.
For Val, the treatment was life-changing.
It didn't hurt. I expected it to hurt. I expected just occasionally when Beverly put the needle in, she'd wiggle it a bit to make sure she'd got the right spot, and it was a funny tingly sensation. But it relaxed me and it made me feel very calm, and long term I benefited so much from it. I started to sleep properly, the nightmares stopped. I've gained so much from the acupuncture. I regained my self-confidence. I always felt as though there was a monkey on my shoulder, and every now and then he came out and he slapped my face with the lymphedema flared. And he's still there, he always will be, but I just slap him back now, and I can control him instead of he controls me, and lymphedema doesn't rule my life anymore. Oh, if you have the chance, try it. You've nothing to lose and absolutely everything to gain. It will change your life.